impact how you think and what you do. A positive mental health is an important part of your overall health and well-being. Being positive lets you live and work more productively. Some ways you can maintain a positive mental health are to connect with other people, stay active, get lots of sleep, take care of yourself, and keep a positive outlook on life. Sometimes you can feel good emotions, and sometimes you can have emotions that don't feel so good, like feeling sad, angry, or upset. Some signs and symptoms that you may need help include having trouble sleeping, a loss or increase of appetite, experiencing body pains, no longer wanting to see your friends. If your feelings are so strong that you want to hurt yourself or others, you are having a mental health emergency. Take control of your situation by calling your local crisis helpline, contacting your local mental health office, or calling 911. Remember,
you never want to call 911.
A good tip is to think of a 2-week time period. If any of these symptoms last longer than 2 weeks, or if you feel them on and off over time, you should reach out for help. Anyone can experience mental health problems. Many life events like a loss of a relationship, loss of a job, health issues, or increased stress can be common reasons. Sometimes not knowing how to deal with your feelings around these issues can make you feel sad or upset. You should reach out for help. You are your own best advocate. You can reach out to your doctor, social worker, close friend, or family member to discuss how you're feeling and decide your next step. Just remember, it is important to be honest about your feelings so that you can get the right kind of help. When you meet with your doctor, they will ask you lots of questions to better understand your mental health. They also may be able to put a name to what you are experiencing, which is called a diagnosis. Some common mental health diagnoses are depression, anxiety, and post-traumatic stress disorder, also known as PTSD, among others. Remember, you are not alone. If you are concerned about your mental health, there is help. When talking about mental health, it is important to understand that everyone has emotions and everyone experiences good days and more challenging days. We can all do our part to end the stigma about mental health. What is a stigma? A stigma is a set of negative and often unfair beliefs people have about someone or something. There is a stigma when it comes to mental health. People living with mental health conditions are often negatively judged, and that's not okay. To help end stigma around mental health, we can start by talking openly about it. If you are experiencing difficulties in your life, you shouldn't feel ashamed to ask for help. Ignoring the problem won't make it go away.
I recognized that my mental health was not positive. I reached out for support, and now I'm doing things every day to help me feel better. Always be your own best advocate. You deserve the best care available.
You guys want me to play it again?
No.
Okay.
That sounded good.
Okay, so I'm going to take it off. Okay, I'm going to go to the PowerPoint.
Do you have a PowerPoint presentation? I don't have a PowerPoint presentation, Wesley.
Okay.
Yeah. No, I'm just.
Okay, this is okay. I'm just going to talk. So, what do you guys think about the video? What do you guys think about the video?
It's very good, but I already saw it before because I kind of like, it's just like a repeat for me. So I already saw it, so I already know what happens. I think.
Okay. Okay, so what else? So let me get to this PowerPoint.
I thought it was good. That was my first time watching that video, so it was new content, and I thought it was had some helpful information.
Okay. Okay, now I get the PowerPoint. So we're talking about mental health. Mental health is very important because anybody can have a mental health diagnosis. Anybody. It could be a celebrity. It could be an entertainer. It could be a president, by the way. A president could have a mental health diagnosis. Michelle Obama said she felt depressed about 2 years ago. So
Wesley, I'm so sorry to interrupt. Do you want to show the PowerPoint?
yeah, I do.
Okay, because we're not able to see it.
You don't see it?
No, we're still seeing the website that had the video.
Okay. Let me go back. Let me go back to it.
Okay. Perfect. Thank you.
Let me go back to. I'm sorry, technical difficulties. Okay. I need to go back to the beginning. Okay. Okay, you guys see it now?
Yes.
Okay, mental health. So what is mental health? Do anyone know what mental health is? Do anyone know? Okay, so I'll talk about mental health is an important part of your overall health and well-being. This includes understand your feelings, know how you think and feel about your life, understand how you handle stress, taking care of yourself, exploring when and how to make healthy choices. So that's mental health. You guys know that? So any questions? Okay, we'll move on. I'm gonna ask you guys, how do you make yourself happy? How do you make yourself happy?
Listen to music.
Okay. Yes. You could volunteer. Volunteering makes me happy. I did this weekend.
So listening to music, that's a great idea. And then you're saying that for you, Wesley, is volunteering your time?
Yes. And you hang out with your friends. That's a good way for your mental health too. Okay, so we're going to continue. Emotions can impact how you think and what you do. When you feel good, you can manage your life more easier. You can do the things you usually do. This is positive mental health. Okay, let's put this on. How to encourage positive mental health? Connecting with others, being physically active. Like yesterday, I exercised, I played basketball, getting enough sleep, asking for help if it's okay. So you ask for help if it's okay. Having a positive outlook and eating healthy meals. So you guys have any questions about positive mental health? Any questions? Okay, we'll move on. Medication.
I locked that door, I'm sure, but. Hi, Maria. I knew I locked it
Prayer,
when I came back in.
watching a funny movie, being around loved ones, or writing. So for example, I know my dad liked to watch funny things on YouTube, so he watched funny things on YouTube, and that puts him in good mood. So you guys have any questions about positive mental health? And another thing, I told my coworker today, another thing about positive mental health, turn off the news. You guys know about that? Can you hear me?
Yes.
So another thing about positive mental health is turn off the TV, because sometimes the TV could be really, it could be very depressing. So just turn it off. So any questions about positive mental health? Concerns about mental health. You might be concerned about your mental health if you're feeling what emotions for more than 2 weeks. So if you have something for more than 2 weeks, you might want to talk to a doctor or a therapist. And here we go. If you're sad for more than 2 weeks, if you're confused, if you're worried, if you're scared, if you're upset or angry, if this is happening for more than 2 weeks, that's when you want to talk to somebody. Or if you can't sleep, if you don't feel like eating, if you're feeling pain, if you stop showering, if you stop seeing your friends, if this is you should talk to somebody about something, about this. You might want to contact your doctor, someone for you, if these feelings continue, if they keep coming back, if they keep you living the life you want to live. So you talk to a professional if these things last for more than 2 weeks. It's okay to ask for help. In fact, one of the YouTube bloggers I look on that does things in Las Vegas, he was depressed for 3 weeks, so he didn't come on for 3 weeks. So it's okay to take time off for yourself, because mental health is very serious, and nobody's immune from mental health issues. It can happen to anybody. Anybody can have mental health issues. Any questions? It is okay to ask for and to get help. So is it okay to ask for and get help?
Yes.
The answer is yes. What if I need help with my mental health? Who should you talk to? Who should you talk to if you have problems with mental health? Do you guys know? You guys know?
The therapist, maybe?
Yes. Anyone else you should talk to if you have problems with your mental health?
Maybe a school counselor?
Exactly. You could talk to a counselor, you could talk to a psychologist, you could talk to a therapist. Who else you should talk to?
Your parents?
Exactly. You can talk to your parents, you can talk to your staff, you can talk to your friends. That's who you talk to if you have problems with mental health. Or if you work, you can talk to your employment assisted program. You guys know about that? And some places where you work at, if you have problems with your personal life, you can talk to your EAP. So I'm going to continue on. People who know a lot about mental health and that can offer treatment. That could be a psychologist, that could be a therapist, it could be a counselor, it could be a social worker, and other mental health care providers. So that's what we talk about with mental health. Any questions? We continue on. Other people that can support you. We talked about earlier, your parents, school counselor, your friends, your support staff. Your support staff can help you out too if you have problems. You guys know that? And mental health issues can happen to anybody. There's some Anybody can have mental health issues, anybody. Other people can support you. Besides a therapist, you can find a person in your life you can trust and talk to them. And by the way, everything we talk about here is confidential. You guys know that? This person could be a family member. It could be a friend. It could be an advocate. It could be a staff person. It could be a caseworker. It could be another doctor. It could be a phone crisis line worker. I want to tell you an experience I had. I went to a program about 9 years ago. And when I was doing my presentation, one of the participants had a sharp object trying to kill herself. And that's what we call a mental health emergency. If that happens, you call 911. You guys know that? So what else can I do to feel better? You can exercise. You guys know what exercise is? You guys know what exercise it is? It's like walking around, going out in your wheelchair. It could be a lot of different things. Exercise can make you feel stronger and more control, less angry, more calm, less stress, happier, better about yourself, less lonely, and more part of things. So walking around the park could be good. Using a wheelchair, go around places could be good. And you could just do exercise with you get weights at home and do things like that. What's another way to feel better? Eating healthy. So you notice when you eat a salad, you feel much better than if you have burger and fries. You guys know that? So we eat healthy. You're stronger and healthy. You're less stressed. You're happier, better about yourself. And taking medication. You should ask questions about any medications, including what they are and what they do. So you guys know about medications for mental health issues? You guys know about the medications? In fact, when I was doing my CERT training this weekend, the firefighters saying that a lot of people are depressed in town, so they go to the hospitals, and the hospitals would give them medication, might give them Xanax to make it feel better. But the hospitals, unless it's a mental health hospital, they're not really into mental health issues. They can help you out a little bit, but mental health professionals would know better. It's a start to go to a hospital, but you go somewhere else in the hospital sometimes. So any questions? Reasons why I need help with my mental health. Here are some reasons you might need to ask for help. Too much stress caused by finances, relationships, health, and transportation issues. Like for myself personally, I'm going through a divorce, so that's a lot of stress. And I have friends to talk to, and that's my support group. Difficult life experiences. So we go to different life experiences, and that's why you need help with mental health sometimes. Not knowing how to cope with feelings. So you might get upset or disappointed. You don't know how to cope with feelings, so that causes problems with your mental health. Family history of mental health problems. So we have family history of mental health problems. That could cause mental health problems. When a loved one dies or leaves. So when someone dies or they leave, that could cause mental health problems. Medical reasons. I got friends battling cancer. It's very draining because you gotta go to all these different places for treatment, and it's a drain on the mental health. And that could cause problems with your mental health. Feeling lonely. I think everybody feels lonely one time or another. Even the president of the United States might feel lonely. So you need help with mental health if you feel lonely. History of trauma. So if you have a history of trauma, that could be a reason why you need help with your mental health. So any questions? Some examples of mental health diagnosis: post-traumatic stress disorder, PTSD, bipolar disorder, anxiety, depression, obsessive compulsive disorder. Want to know more about a mental health diagnosis? Ask your doctor or a mental health expert for a website on a diagnosis. So you can do it on your own too. You can look on the internet to see about depression or bipolar or post-traumatic disorder or stress, obsessive compulsive disorder, or any type of thing. Ask your doctor or mental health expert for more information. So any questions? So I explained earlier what a mental health emergency is. A mental health emergency is when you get feeling so intense, you want to hurt yourself or you want to hurt other people. So you guys know what a mental health emergency is? One example of a mental health emergency is when my feelings are so strong, I'm fiercely hurting myself or another person. This type of emergency is called a mental health crisis. A mental health crisis is when you have feelings so strong, you want to hurt yourself or hurt someone else. What to do in a mental health crisis? You call the 24/7 crisis helpline at 1-273-8255. That's a suicide hotline. You call 911 for emergencies. When you call someone will offer you advice, tell you to go to the hospital, or an ambulance can come and take you to the hospital. So if you need help, you can always call 911. They can take you to the hospital. So any questions? We're gonna move on. Do anyone know what mental health stigma is? Do anyone know?
The negative attitudes related to mental health.
Exactly. So there's stigma going on with mental health. And the best way to end the stigma is to talk about mental health. So that's what we're doing today. Recognize it's normal to have difficulty with your mental health. And by the way, Abraham Lincoln, he was a president of the United States. He had bipolar depression. So even the highest ranking people in our country have problems with their mental health. Knowing it's always okay to seek mental health help when you need it. So you can seek help when you need it. You can take time off if you need it. In the stigma. So any questions? We're gonna wrap things up. So what do you guys learn today? What did you learn today? How to help mental health stigma. So I'll repeat again because I record again. I take charge of my mental health when I know what mental health is. I'm aware of changes in my feelings and emotions. Reach out for support to get better. Try new things to help me get well again. Knowing that anyone can have problems and concerns with their mental